Hi everyone, my name is Bansri Patel and I'm a third year medical student at the University of Pittsburgh. Today I'm presenting my abstract titled The Student Dermatology Clinic for the Underserved, also known as SDU, a service learning initiative for dermatology residency training programs. Uninsured and underserved communities face several barriers to accessing dermatologic care, including longer wait times and higher rejection rates than patients with private insurance. This underscores the need to expand access to dermatology providers in underserved populations, as these gaps in healthcare have negative impacts on dermatologic health outcomes. Free clinics can be an instrumental resource in marginalized communities by strengthening the local healthcare infrastructure and helping to bridge the gap in access to care. The Student Dermatology Clinic for the Underserved, SDU, is a student faculty run free clinic that serves patients in marginalized populations in Southwestern Pennsylvania. The objective of this study was to describe and evaluate the SDU clinic as a sustainable service learning model in order to increase outreach and offer culturally rich and medically challenging learning experiences for all trainees and medical students. To provide some background on the SDU clinic, SDU functions as a partnership between dermatology residents and attending physicians from the University of Pittsburgh Medical Center, UPMC, Department of Dermatology, medical students from the University of Pittsburgh School of Medicine Dermatology Interest Group, and the Squirrel Hill Health Center, a federally funded community health center. SDU hosts 4 to 6 clinics annually, with approximately 8 to 15 patients seen per clinic. Patients are referred to SDU by primary care providers at the Squirrel Hill Health Center. Medical students from the Dermatology Interest Group at Pitt coordinate student volunteer and patient scheduling. The UPMC Department of Dermatology provides all necessary supplies, including biopsy kits, and biopsies are read by the UPMC Dermatopathology Unit at no cost. Patients are first seen by a team of medical students who present the history and physical exam findings to a dermatology resident. A medical student and resident team then evaluate the patient together, which provides residents with a teaching opportunity. The dermatology attending physician also precepts the medical student and resident team as they devise patient care plans along with providing patient education. Patients benefit from access to low cost prescription drugs and coordinated follow up care. To evaluate our free clinic as a service learning model, we administered a voluntary survey to SDU dermatology resident participants. 88% of dermatology resident volunteers, which was a total of 8 residents, reported that their involvement with SDU was deemed a high yield learning opportunity that increased their awareness of health disparities and social factors impacting dermatologic care and encouraged them to be more involved in community service throughout their career. Some of the challenges associated with implementing our free dermatology clinic included scheduling conflicts, as the SDU clinic is limited to evening hours, which may limit attendance by patients and providers. Since the patient population of SDU is both culturally and ethnically diverse, we utilize telephone and video translation services to communicate with non English speakers. During the COVID-19 pandemic, which resulted in patient care restrictions, the providers at Squirrel Hill Health Center have discussed and coordinated patient care with the dermatology faculty at UPMC using teledermatology. Overall, we have identified SDU as an effective service learning model that facilitates vertical learning and interprofessional collaboration amongst trainees. By partnering with a local community health center, we were able to provide patient centered longitudinal care while reducing barriers to access in underserved populations. In this service learning model for residency training programs, we not only address the dermatologic needs of marginalized populations, but we also create a rewarding training environment for medical students and dermatology residents. By exposing dermatology residents to the diverse patient population served by free clinics, including minorities and patients with skin of color, dermatology residency training programs can increase resident competence and confidence in recognizing, diagnosing, and treating diseases in patients with skin of color. Incorporating service for the underserved into the dermatology residency program curriculum holds programs accountable for enhancing the cultural competency of its trainees, fostering interest in health disparities, and mandating that skin health equity be made a priority. Thank you for listening.